Hey, all right, let's kick this off. What do you recommend to people who have anxiety with wearing masks?
Well, it's a very difficult one to answer because everyone is unique. Everyone has a different background, upbringing, etc. You know, the nature and nurture thing. Anxiety, in its truest sense, is fight and flight. So when someone has low-level anxiety all the time, having something in front of their face could bring on an anxiety attack, a panic attack, in other words, having something close to their face. In the UK, if you have that, you are exempt from wearing a mask. And so from that point of view of here in the UK, you don't have to wear a mask. Now, obviously, state by state is going to be different. So you'd have to check up on that. But I think if you have anxiety, then my advice is don't wear a mask as long as you are within the rules and regulations of your state. That's all I can suggest. So these are suggestions. There is that disclaimer at the beginning. But really, it's pointless you wearing a mask if you're going to have an anxiety attack. Worry is something different. That's a lower level. You could overcome that by just reframing why you're wearing a mask and why there is a need to have a mask. But generally speaking, if you have low-level anxiety and it peaks when you are wearing a mask, then either don't go to dance class or... Oh, my screen's gone blank. Are you still there?
We can hear you.
Oh, you can. Okay, that's all right. You just can't see me.
Okay.
Did you get all of that? I'm sorry.
Yes, I got everything you said. It's getting a little bit fuzzy, but yes, thank you.
All right.
And
okay.
so, Dr. Iafrate, I actually want to jump to you now because there's another question. I'm going to ask you a few mask questions. And then everyone who's listening, please understand that there are different perspectives on this. We're not saying do something, don't do something. It's just answers to different considerations. And please know, science and data is changing so fast. So what was presented a month ago, some things are going to be different because the data has shifted. So Dr. J, first question, should you wear a mask while dancing?
Yeah, so hopefully most of the people on here were able, can you hear me okay? I'm seeing freezing.
You're breaking up a little bit.
Welcome to Zoom, everyone.
Is that
We've all
better?
been through it. It's all good.
Are we good now?
Go back. Yes, I can hear you.
Okay. All right. So hopefully you guys were able to watch the initial video that we did last month, because that did have a lot of really good information, but things are, as Galit said, always changing. So along with the idea that Terry was talking about, everyone should be wearing a mask, presuming they can tolerate it. And most people should be able to tolerate it. So the CDC recommends that anybody above the age of 2 should be wearing a mask. Obviously, anybody younger than 2 is not going to know what to do with it. They're going to fuss with it. They can't control whether or not it's bothering them. For the rest of the people, you should be wearing a mask when you're dancing, including the teachers. And there are some cases where anxiety might limit your ability to tolerate it, but chances are it's because the mask actually just doesn't fit you properly. And so you're probably sucking in the mask and having it touch your mouth. And that's usually what ends up becoming so anxiety provoking. So we did recommend that if for some reason you absolutely cannot tolerate a mask, then at least doing a face shield might be the next best option. Now, the research does show that there's not really anything that proves that it's a good substitute necessarily for a mask, but it's better than nothing. And if you are going to have to use a face shield, I of course have little demonstrations, then you need one that wraps around the face and actually covers the chin. So I'm going to put this on and look really cool for all of you. But it should look like this. Obviously, it's covering my chin, it's covering the sides of my face. And so that would be the only other thing that I would say if you absolutely, absolutely cannot tolerate a mask, that's what I would at least recommend doing.
And just to reiterate, is this recommendation outside of dance class or specifically within the dance class space?
Oh, both. So you should be wearing a mask outside of dance class, even especially within the United States. According to our numbers, I think we had the highest number of deaths yesterday since May. So we're not done with COVID, unfortunately, here in the U.S. So people should be wearing cloth masks outside of dance class, but even within dance class, most people should be able to tolerate it just fine.
Perfect. And so I want to just be crystal clear in my understanding and make sure, because this is based off of submitted questions. The next 3 questions would have been, 1, if you're suggesting to wear a mask during dance, which you are, is that for all ages? And you said the CDC said after 2 years old. So is that the same cutoff as what you'd recommend for dance class?
Yeah, so there's nothing that's in the research that shows, in terms of dancing, what's the best age to start wearing them at. I certainly think anybody 5 and up should be able to tolerate it without much issue. But Dr. Meier actually told me that her 3-year-old, I think it was able to tolerate wearing a mask while doing ballet. So I think 3 years old and up, if they can tolerate it, it's a great idea, definitely for 5 and up.
Great. And 2 more quick ones before we move on, just because I want it to be crystal clear. Is it okay if the dancers are wearing a mask but not the teacher, and vice versa? Is it okay if the teacher is wearing the mask but not the dancer? You said it,
No.
but I just want to make sure it's understood.
Yeah, no, that's a really important question. So dancers should definitely be wearing masks while social distancing and everything else, which we'll get to. But I mentioned last time we did this that a cough can travel about 8 feet, and yelling or singing, which lots of teachers are doing while they're clapping along to the time, can actually travel even further than that, up to 10 feet. So a dance teacher absolutely should wear a mask, even if all the dancers are wearing masks. We wear masks to protect each other. So your dance teacher should be protecting the students the same way the students are protecting the teacher. So everyone in the classroom should have a mask on.
Thank you so much.
You're welcome.
I'm going to move on to Dr. Bluestein. There's a lot of questions around, and just so you know, perfect. There's a lot of questions around like props and sanitizing the floor. So, and we went over this last time, so I want to see if it's still the same in terms of what the answer would be. Is it better to use props, again, sanitized by the studio, or have dancers do it at home?
So the biggest thing about props is that we don't want to be sharing props. So I do think actually if the studio can provide them and ensure that they have been, sterilized appropriately or sanitized, or at least have enough time between when the last person touched them and the next person touched them, then that would be a good way to ensure that they have been cleaned properly. But the biggest thing is not for one person to be touching it and then for someone else, for another dancer to be touching it, because that's when, there's more of a risk. So it's human to human, that's the biggest risk, not so much on the surfaces of things, but it's also a time factor. So the shorter time interval between when one person is touching something and when someone else is touching something, the more the risk.
And how would you recommend to go about disinfecting a prop?
So that would be, you could do that with, there's a number of different recommendations for, I think we have a link maybe to the approved sanitation things from the CDC. And if necessary, that you can also make your own with bleach, but they also give, on the CDC website, they also give some very, very, very specific things about if you're going to do that. Otherwise, you want to use an EPA-approved disinfectant that's at least 70% alcohol.
Thank you.
And then let it dry for at least 30 to 60 seconds, sorry.
No, it's all good. Thank you. For at least 30 to 60 seconds. Thank you. And then we have someone that said the disinfecting cleaning is ruining Marley, and they've heard that European studios just use soap and water. What are your thoughts on this? Is soap and water normal Marley cleaning okay, or how does that need to be handled?
So there's actually, again, hopefully we have the link for this also. The Dance USA Task Force on Dancer Health did also address this question, and they recommend that once a day the floors be cleaned as usual, followed by cleaning with a 90+% alcohol in a sprayer bottle. And there's a product that's available on hdhudson.com website, and it's a bug Bug-Weiser sprayer that you can spray onto the floor and then spread with a mop. And then they say the mop pad should be washed with soap and hot water in the washing machine between uses. And that disinfecting of the floor should happen prior to every class or rehearsal.
Thank you. And is it okay to have a yoga mat on the floor?
That's really probably not the best thing to do. Although we know that this is much more a respiratory, hands are more of a concern. It's better to actually be avoiding floor work and touching of floors. The Dance USA Task Force on Dancer Health did address this also. And they say if necessary, if floor work is necessary, consider spacing out class and rehearsal times so that you can disinfect the floor in between. And then you would want to do the same thing with yoga mats and no sharing and, disinfect the yoga mats in between.
Thank you. Which leads me to the last one before we move on to the next specialist. There's a studio owner who's seen recommendations to clean floors between classes, but she or he says, or they says it's just not possible for the studio. How much risk of transference from floor work is there, particularly from one class to another? Are towels for basic floor work or resolution?
I mean, I think a towel, if people are getting on the floor, that's when there's the risk. If they're just standing on the floor, then, I'd say there's minimal risk because it's just, their feet. But otherwise, if you are actually doing floor work, I would think a towel or a yoga mat would be a way to at least minimize that. Nobody really knows exactly how much risk there is, but those kind of things probably would help.
Thank you. And Dr. Meier.
Hi.
Hi, how's it going?
Good, how are you?
Good. Oh, thank you. So I'm gonna have a few questions for you as well that are all related. So is it okay for studio owners to stage dances where they're dancing closely but still wearing masks? So I would assume this is really within 6 feet, maybe closer than that.
I think the hard thing about that is the two things we know that work right now for decreasing transmission is going to be keeping our mouths and noses covered and keeping that space. And that combination together is what's most effective, is when both parties or all parties are doing both of those things. And so right now with the data we have, I think that it's a hard thing to say that we're safe to do partnering or do close contact work with choreography. I think also another thing to keep in mind too is, are we looking at a studio class to where, kids are moving class to class to class, interacting with a whole bunch of people versus a singular company? That's going to really change how we're going to have exposures around. So I think some of the recommendations I've been seeing more for the companies, which are going to be acting more like the MBA bubble, so to speak, to where they're just kind of staying contained and this is their job and they're just coming in and out and this is kind of their singular cohort they're interacting with, that even is going to have some risk to it when you're doing the partnering work, but still less than I would anticipate with studios that have the kids that are going to school, going into the community, doing all sorts of things. So right now, my recommendation is that I don't think it's worth doing the close contact, not until we have more information to tell us otherwise. I think especially with the schools starting very soon and knowing that one kid who may or may not be wearing their mask right the whole time could expose everybody, I think the risk is just pretty high with that, because all it takes is one mask dropping below the nose and a sneeze, and all of those people that were in that close contact are at risk. Because like Dr. J said, whenever we're talking about the mask, we're talking about preventing that exposure. We're talking about me not infecting you when I'm wearing a mask, not the other way around. So I would say right now, this isn't going to be forever. We're getting new information all the time. Let's keep everybody apart as much as we can whenever we're rehearsing.
And I'd like to highlight something in there, because when I go outdoors outside of my bubble for those like 30 minutes a day, I constantly see people where their noses are just out. I think my friend's brother started a t-shirt company called Noses Out because so many people do it. Like, is there something, if you could just speak on that real quick and highlight it, because I think it might not be understood, the importance of this.
Right. Every day when I'm seeing patients, we're all masking. there's a good subset that the mask is under their nose. And so I think that's the thing, is that when we're talking about transmission, it's from the respiratory tract. The respiratory tract connects from the nose to the mouth. And so either one of those is going to be likely to spread. And like I said, we're blocking our own spread. That's the whole goal. So if I've got it below my nose, I'm only blocking like 50% of my spreaders. And so I think that if you're going to wear a mask, you need to wear it right. You need to be conscious about that. And I get it. When you're talking, it slips down. You know, it's something that you don't want to be messing with either. And so it makes it hard. And so making sure you have a good fit, like Dr. J said, is key. Perfect. Exactly. So when we have it on, making sure that we've got a good fit behind our ears, it's up over your nose. The ones with the wires are really helpful to hold it there, because mine's slipping underneath my nose all day long if I don't have a wire piece. And so I think that these are so helpful to be able to put across there. Plus the ones with the seam across the middle can sometimes hold it up to where it's not slipping underneath. But the more that you can encourage your dancers in your classes to get that over their nose, because I've seen so many classes that are like videoed and they're doing a great job with the mask on, and then you'll see that one dancer in the front with it just like this, and they don't mean to, but they're so in it that they're not thinking about it. And we're trained to not mess with our costumes, but this is the instance. Let's mess with it. Let's make sure we're keeping it up to keep each other safe.
Awesome. And two more quick questions. And I keep on putting in the disclaimers, but everyone, like, I think each question could probably be at least an hour discussion. So everyone's doing their best to answer concisely, but, you know, there's encouragement to keep your eye on the latest studies. And so how many dancers do you feel can safely be in a class for indoors and for outdoors?
I think it depends on the size of the space. So that's a tough one. You know, at Oklahoma City Ballet, we have this huge facility where we can have a lot of dancers spaced 10 feet apart, which is going to be very different than one of our really small classrooms that we could probably only have 6 to 8 dancers just given the size. And so I think that for me, my comfort level is actually even beyond that. I like about 10 feet because we are exerting ourselves more. We are huffing and puffing harder. The teachers are, you know, having a louder voice that they're speaking with, which does spread particles more readily. And so if you can space your dancers in a staggered fashion, keeping 6 to 10 feet apart, I think that's going to be optimal. And go through and mark out your classrooms, you know, put X's on the floor to where everybody stands, and that'll help determine how many you can safely have indoors. Outdoors, I think the risk is a little bit less. And I think really it comes down to how many, you know, I still would want people spacing as much as they can. If they can mask, I would prefer that as well. But how many of these kids can you manage? Because if I've got, you know, 5-year-olds and you know, they're not keeping their masks on at all because they haven't been wearing them this whole time because they've been mostly at home, I don't know that I can keep them safe when they're crawling all over each other, you know. Or 50 teenagers, I don't know that I can keep the 50 teenagers from getting all on each other and taking selfies with their masks off and all of this stuff. So I think about what your space looks like. If you can keep them spaced and keep them compliant, that's going to be your determiner on what's going to be the right amount of number for your classes.
Great. And so does that mean it's a no-go for group photos at the end of class, even if they have masks on?
I don't love the group photos. You know, we've been seeing so many of them, and I've seen some of the videos from some of these classes where they are safe all the way through, and then the kids are getting together at the end and taking the masks off because it's a quick picture. Are we really going to expose each other? And maybe the risk is low, but all it takes is one sneeze. All it takes is just one person turning and talking to the person next to them and spraying 6 feet across their other friends some particles that may be infected. And I know the data has gone back and forth with asymptomatic spreaders, just like with the masking and everything else. But with the newest data, the most current data we have, which is how science works off the best, newest data, we know that we need to keep these masks on and we need to keep that space. So I would say keep the pictures to a minimum right now. Let's hold off on doing those.
Thank you. Going back to Terry, so there was a discussion we had before all of this, and this idea of low-level anxiety came up. And I wanted to know if any of this repeats on the mask question I asked at the beginning, then I can ask a different one. But what would you share to people who are kind of hiding out, not feeling okay, as there's been things on social media where people kind of come back and they're like, hey, I've not actually been okay, and I've kind of removed myself from social media. And Yeah, and any other things that you've been seeing that have been causing what you call a low level anxiety and what that is. I asked it really clunkily, so I could also re-ask if you need. Terry?
Well, first of all,
Okay.
yep, I'm here.
The audio, I
First
can't
of
hear the
all,
audio.
can you hear me?
You take yourself off of the video, it might have a better audio. Okay, let's try it.
Okay. So you have a better view of me there.
I'm so sorry, Terry. We can't hear you.
Two
I could
tone
try.
heavier.
Huh?
Can you hear me?
It's not. I can read it if you type it in a message to me.
Can you hear me now?
Okay, I can hear you now. Let's try it real quick. Oh.
Okay. Can you hear me now? Testing one,
Yes,
two, three.
thank you everyone for your patience as we navigate the wonderful world of
Yes.
Zoom. Yeah.
Sorry about that to everyone else there. Low level anxiety is caused by many different things. Home life, relationships, etc. Also, it depends on your upbringing as well. If there was trauma, perceived trauma, that's where low-level anxiety, most of the time, we don't need the fight and flight mode. We only need, as an extreme, if we're attacked in the street, fight and flight mode comes in, and you run or you fight. But we have, as humans, as modern humans, built in this anxiety that something might happen. So we're always overtly aware. And so we're walking down the street, we're sort of looking, but whereas other people might be so relaxed and actually it doesn't matter and deal with situations as they arise. So there's a fixed mindset and a flexible mindset. Those with a fixed mindset are more likely to have anxiety than those with a flexible mindset. People are easier with a flexible mindset, but when it comes to this low level anxiety, it can peak at any time because there's this ultra awareness of things going on. There's a risk aversion as well. So when COVID comes in, these rules come in, the risk averse people are more likely to have high peaks of anxiety. Galit, I hope that's answered that part of the question for you.
Yeah. Yes, that helps with what low-level anxiety is and how it's showing up.
Okay, what was the other part of the question?
Well, I mean, I'll go more specific. I feel like, conversations I've had and things I've heard, like some people have kind of distanced themselves and aren't feeling okay. I had a conversation today with a friend around like moving locations. A lot of people are moving. I know a lot of people between LA and New York, they're moving away from one place or the other and going back home, or I know I haven't been in my apartment in weeks, and it can feel very displacing also, and kind of like what's happening. Are there any recommendations that you have around self-care or like grounding yourself, rooting yourself during this time as that anxiety might come up from it? Like actionable steps.
I've got 3 therapy clients that lived in New York, and you're quite right. They've moved out to their parents or friends. They've moved out of the city, and that has actually helped in the long run. There's first of all, there's the change. So change for people is very difficult because it's out of their control. For dancers is very important. People, dancers control their bodies, and they need control about other aspects of their life as well. And lack of control brings on anxiety for some people. That's the fixed way of thinking rather than the flexible way of thinking. So once they're settling in their new homes or with their parents, there could be positives and negatives, because if they've moved away back to their parents, what was it like for them as children growing up? Was it pleasant or was it not pleasant? So all of these things can can play. So I can only say generally, I can't be specific. But I think the specific thing is it's okay not to be okay. And I think I said that last time in the talk. And when people realize that it is okay not to be okay, they can be more open and talk to others and explain how they're feeling. That is one way of helping with the anxiety. And for the other people to learn how to listen, not to try and help, not to try and fix things, but just to listen. That's all. Some people with anxiety, or most people with anxiety, just want to share when they feel safe. So having the ability of the people outside of their own circle just to listen to them. So remember, it's okay not to be okay.
Thank you. And so next up, Dr. Iafrate. I'm going to ramp up some of these questions. You ready?
Mm-hmm.
Okay, perfect. Is there any feasible way of holding a dance concert responsibly this semester? Masks on dancers, socially distanced on stage, live stream, etc. Is there any safe way to do this? What are your recommendations?
So we do not know for sure. Dr. Meier and I were talking about this about a week ago, and we think that live streaming, certainly you cannot have an audience, definitely. And if you had a space that was spread out enough that it could still allow for enough distance between dancers and probably still have your dancers in masks, it would potentially be feasible. And then just live stream it or do it on Zoom or whatever you wanted to do. The other thing you could consider doing is filming it ahead of time and doing it that way. All of these are difficult decisions to make. There's a lot of dance competitions that are struggling and thinking, are we going to happen this year, or are we just going to push it off to next year, or do we do this like a virtual competition? And I think that's going to be the safest option. It's different if we had a vaccine, which we don't yet, and we probably won't until early to mid 2021, to be perfectly honest. Or if you could test everyone ahead of time and they kind of remained in their little bubble, like Dr. Meier was talking about. So some of these dance companies might be able to do that, but most dance schools are not going to be able to force testing on all of these students, especially the rapid test that you get the results back kind of right away. Otherwise, if you have to wait 3 to 5 days or 7 days for a result, you could have gotten infected during that time.
Do you know what, this is, I know, on the spot, but do you know of the accuracy or validity of the rapid test that gives you the results in 15 minutes?
I don't know off the top of my head. There's a lot of tests. Do
you.
either of you guys, I don't know if Dr. Bluestein or Dr. Meier does off the top of their heads.
There are several different ones, and
Yeah,
so the ones that we were seeing earlier that were coming out like in like May, June, had really poor sensitivity and specificity, which what that means is basically that's the way we know, one, is it right when it's right? And two, when it's right, is it right just for COVID-19, or is it also including the other run-of-the-mill coronaviruses that we get other times of the year? Now there are a few that are better in the sensitivity and specificity. This is it right when it's right is more on par with what the swabs that reach so far back. So some of them, yes, it's hard to know what's what. And whenever you go in asking the person doing it, well, what test are you running? It's a hard thing. And so right now, I think that most people are using the more accurate version. And so, and I think we're seeing just better stuff come out all the time.
Yeah, I think I agree that the swabs are the best option. That's what we're using in the hospital for like hospital workers. That's what we use on our patients that we think have COVID. So that's definitely one of the better options. But these super rapid ones they're all different and they're all made by different companies. So it's tough to tell who's got the best stuff.
And the only thing I would add is the person doing it probably doesn't know what the company is, and even the doctor ordering it, or even when you get your results, it doesn't necessarily say. So that's one issue. Another issue is it's very much dependent on timing. So you can have, the presence of the PCR or the RNA virus isn't necessarily the same as the infectivity of the virus. What we want to know really is, are you infectious or not? And the test isn't a perfect match for that. So they can show curves of where you get the virus peaking and then it going down and then the antibody going up. you can actually have a window in there where actually both come back negative. So it's a timing issue too, right? That depending on when the test is done and the right test is done. So.
Dang, fascinating. Everyone, you get how deep this is? And I'm gonna hopscotch real quick to Dr. Meier because I have a similar question for you. So there's a studio, they have competitions that are scheduling stuff starting at the end of August. Is this safe to do? They're afraid to start attending. And everyone, we know this is like a sensitive topic. We want to acknowledge that, but what do you say to that?
You know, I know that conventions and competitions, they have to make money, and everybody is eager to get back to these, that you guys have all trained so very hard to lose your nationals this summer and everything else. So I understand how much you want to go to these things, but I would say if your competition is putting things on business as usual without any kind of changes, without any kind of mandates really, and I know that's kind of a buzzword right now, is being told what to do. But if the competition is not controlling their space, it's probably not a safe place for you to go. I think that right now, the virtual piece is probably your safest bet, just because coming to a competition, that's the whole thing. These competitions are drawing people from every corner of your state, of your region, of the country, if we're looking at nationals. And we're looking to bring people in contact with other people who are probably exposed. And so the way, just thinking about what the competition usually looks like, the super packed dressing rooms where everybody's on top of each other, backstage where each group is lined up in front of the next one, it's very hard to have the appropriate space. I just don't know that it's doable right now. And so I would say competitions are tougher. Like Dr. J was saying about performances, that makes a little more sense because I can control that if I'm the studio owner. I can say this is when we're performing, how we're performing. If you wanted to do that, bringing one group in where that's just the only group coming in, keeping them spaced, getting them on stage, especially working with the little biddies, that's very doable. And then having it spaced where each person maybe gets one person to watch, everything else is live streamed and everybody is spaced out appropriately in the audience. That makes sense, but I just don't see how that's doable with all the coming and going with pieces during competition. So for now, I would say I would hold off until the spring and just get your routines just to where they're outstanding come spring. You got all this time to clean now. We will have a better game plan come spring. And so I think if we're focusing more on that, more what we can do and less on what we can't do, I think that'll help keep your dancers in a better space with preparing for this.
Thank you. And back to Dr. Iafrate, I'm seeing a conversation around asthma come up. So if you have sports-induced asthma, how should you handle wearing a mask while dancing? And also, are there any legitimate medical conditions that would prevent someone from being able to wear a mask?
Yeah, so that's a little bit of a loaded question, but generally speaking, there's not technically any medical conditions that prevent mask wearing, technically. There are people that have significant lung disease that may be at higher risk, especially if their mask does not fit them very well. And I'm talking about cloth masks. I'm not talking about N95. So some of these respirator masks, while we wear them as hospital workers because they help filter the teeny tiny particles that COVID is involved with, but it does make it a little harder to breathe sometimes. Whereas the cloth masks are a little easier to breathe through, but sometimes, again, if it doesn't fit or it's too soft, then you can kind of suck it in when you breathe hard, and that could make you feel like you can't breathe as well. And so a proper fit is important. I mentioned this thing last time and it came in. So this is called a gauge or a mask bracket. It's apparently a lipstick protector. So if you have lipstick on, I guess it'll look beautiful. But it fits over your face like this. Yeah, exactly. And then you can actually stick it into a mask. And this might be something that people with asthma could potentially use because it's not going to feel like it's blocking their airway. Most of the discussions about hypercapnia or like having too much CO2 don't seem to be as big of an issue with these little fabric masks. But if somebody does have really significant respiratory problems, dancing closest to a window or door is probably in their best interest, getting better airflow and maybe limiting the amount of time they're dancing. They can get breaks in between. And then, I mean, if you are seriously having major respiratory issues, dancing might not be a good idea right now. That might be the other thing. But anyways, just to show you how this little gauge thing fits, super adorable, I know, but no air comes in. And if you don't believe me, you can go onto my Instagram at Columbia Dance Medicine, and I skipped in this thing for like 10 minutes and I breathed fine. My face got really sweaty, but other than that, I could breathe no problem. And I do have exercise-induced asthma. So just something, food for thought.
And then, I mean, I feel like the second part is a great question and so loaded probably. Are there any legitimate medical conditions that would prevent, that's basically what you said, that like there's no clear, I just want to make sure I understand, that there is no clearly defined medical condition that would keep someone from wearing a mask. And also, I want to just outline this for everyone listening. So let's say that I went to the dance studio and I was like, I cannot wear a mask. For medical reasons, I cannot wear a mask. Does it mean that I am given an exception at the studio and I'm told to stand 10 feet away, or is the advice that I stay at home?
So it would be smart probably to stay at home, or if you absolutely cannot wear a mask, at least having a face shield on. But before you plan to think that that's your problem, I would really recommend trying different types of masks. A lot of times the issue is the mask is too tight, and so it's smushed up against your face too close. There are masks that kind of hold their shape. They've got that seam down the middle so that they don't get sucked in as easy. And this one's a little bit sturdier fabric than some of the other ones are, for example. Otherwise, you can use, this is an N95. I don't recommend N95s for lay people. We need them for healthcare workers, and they have to be fitted to your face properly to be useful anyways. But having something that's shaped kind of like an N95 with this cone shape would potentially be a great idea. And Dr. Bluestein just wrote in there, it's helpful to build up gradually. So get used to wearing it. Test yourself. Try skipping for 5 minutes, then try skipping for 10 minutes, then try dancing for half an hour, and work your way up. A lot of it is just getting used to this thing. If you feel like you're suffocating, chances are you're just wearing it wrong. And do you want to go on to the valves, or do you want to wait?
We could go into the valves, and then I want to give a quick plug. After that, we're going to probably save it. We have a mask specific Zoom coming up. I don't know if it's confirmed for the 27th, but everyone keep an eye out for the confirmed date, which will be rolling out.
Yeah.
Can I add one? Oh, sorry.
No, go ahead.
I was going to say, if I could add one thing too, as far as like, should we allow them to, or should they be dancing in the studio? These recommendations aren't for anything other than safety. And this is, with going back to school, we need to have these kids back in school. I get for many different reasons. Dance is kind of a privilege, and dance is something that we don't have to be doing. I know that our souls want to do it, but in person, we can be doing the Zoom classes instead. And so if a kid really can't wear a mask, this is not like a life or death thing to go to dance, but COVID could be a life or death thing for the teachers, for the kid, for the people that the kid infects. And so I think keeping in mind that this is a very serious thing. And so just like, if you're going to be a race car driver and you don't like to wear seatbelts, or you can't wear seatbelts for some reason, you're putting yourself at risk, and it's probably not worth it to be a race car driver at that time until you can wear a seatbelt. Same thing with masks.
Perfect. Thank you.
Perfectly said.
And should we go into valves? And then also my medical specialist, I know I'm kind of giving you each a few questions. Don't worry, I'm going to go back around. Dr. Iafrate.
Yeah, so we'll expand on this in the mask talk, but there was a question about those cloth masks that have the valves in them. So those are supposed to help filter air on the way in. How well they work is up for debate, but what they don't do is filter air on the way out. So it does make it easier for you to breathe. The problem is the breath that you are letting out is just the same breath that's behind the mask. So now those respiratory droplets with the water vapor, your carbon dioxide, everything you're blowing out of your mouth is going out through this unfiltered port. So the CDC actually recommends nobody wear valved masks. And that's actually even true for healthcare workers. We're trying not, so this is an N95 mask that does have a valve in it. And so we've had to use these on occasion just because we were running out of masks, but they would much prefer I wear this one versus this one. And that's because if I was sick, I could still technically infect someone with this valve in mine because I'm now blowing out my unfiltered air. So the way to stop that is if I had this on my face, because I really like how this one fits and it, I don't know, it doesn't block my face too much, I could put a surgical mask over top. So this is how we've been wearing them in the hospital, is imagine this was over my head. But basically it's both pieces, so that you're still getting the benefit of the N95 or the shape, at least the benefit of the shape, but you should cover up the valve with one of these. I actually just had to fly back from Denver yesterday and I saw so many people on the plane wearing valved masks. And I was like, that is not what you're supposed to be wearing in here. And of course they didn't say anything, which made me very concerned. So just think about respecting everyone around you and trying to use the ones that don't have valves.
Great. Thank you. And now just so you know, everyone, I see the questions. I'm doing my best to round it out. So Dr. Bluestein, we have a lot of questions here and some prepared around air in the studios. So I'm seeing one that I think is really spot on around, yeah, so basically, like, how do you properly ventilate? So first, let's say that there's no AC. Is there a way to properly ventilate with a fan, or is the fan just going to be spreading the virus in the air?
So can I first mention one thing from what we were just discussing about the masks and what Dr. Iafrate was saying about the valve. I know of a healthcare worker who didn't know that they had COVID. They woke up one morning and were really, really sick and had been working up until like a few hours before they got sick. And we know that that's when you're more contagious, actually. And this person was in close proximity with other people, but wore an N95 mask because that's what's required of where this person was working. Anyway, not only did nobody get sick that he was working with, not a single person, a bunch of them were tested just because they were in close proximity, and all the tests came back negative because there was concern that could any of them be like an asymptomatic, carrier and stuff like that. So I know that's just an anecdote. It's not a study, but it's, to me, that was really compelling and made me realize that masks really do work. Now, I know in this case, the person was wearing an N95, but it was indoors and sometimes in a small room where you couldn't socially distance adequately. But again, it's an essential business because you're providing healthcare. So the masking is so important and really does work. But anyway, okay. So about air and ventilation. So ventilation is super important. And we know that if we can do class outside, that's better than doing it inside. And if we can do it inside, if we have to do it inside, if we have more airflow, that's better than less airflow. I know probably a lot of people are familiar with that case in China where the air conditioning, they believed, was responsible for getting a number of people sick at nearby tables of someone that had COVID. But in general, if we can get more air flowing, it's better. So opening windows and doors and using fans, the CDC does recommend that we do that.
Thank you. So, like, really specific situations with no AC, is there a temperature at which dancing isn't safe in a studio, even if doors and windows were open?
So I think Dr. Meier shared something last time, a link about like the temperature for outside.
Right.
I don't know if there's any, safe temperature inside necessarily. If you don't have the ability to do AC, I mean, I don't know that that's any different than what it would have been before COVID, except for the fact that you can get heated up more easily if you're wearing a mask, because the carbon dioxide that you breathe in is going to be potentially a little bit higher than the carbon dioxide that you normally would be breathing. So that's the other risk, is a little bit of overheating and or getting your heart rate elevated more. But if you can increase the percent of outdoor air in your HVAC system, if you have that, that's beneficial.
And so what about, and I know I might be asking some questions that are a little bit repetitive, but I just want to make sure it kind of files into the specific questions. So what about a studio with central air versus a studio with wall units?
Okay, so if they have central air, or if you have the ability to, apparently, you know, some of these things, I'm not, you know, an expert in, ventilation systems per se, but the CDC does have information about this. And they recommend, you know, if we can, again, increase the percentage of outdoor air in the HVAC systems, increase total airflow supply to occupied spaces, and then apparently there's a demand control ventilation mode that would reduce air supply based on temperature or occupancy, and they recommend that you disable that. They also recommend that we improve central air filtration, and they recommend running the building ventilation system even during unoccupied times in order to maximize dilution ventilation, and also generating clean to less clean air movement, and that also can involve like one-way traffic through the building. And also they recommend considering using portable high efficiency particulate or HEPA filtration systems that can potentially help.
Thank you. And then what about teaching, dancing, rehearsing in badly ventilated? I know it's kind of a reiteration, old studios. How much does that increase the risk? I feel like that might not be possible to really answer, but how much would you say that increases the risk, or thoughts on it?
So it depends on if you have any of these other things, like if you have the ability to run an air purifier with a filter. Again, that we don't know how much that helps because it's dependent on the rate of clean air delivery. But that might help somewhat. If you have exhaust fans in the restrooms, you want those operational, and that can help somewhat. There's something called ultraviolet germicidal irradiation that can also help inactivate the virus. But if you have poor ventilation, you probably don't have access to that. It's also a time-dependent thing. So the longer that you're in there, the closer that you are to other people. The dose matters a lot. So if you're farther away, and or if you're in there for a shorter period of time, that can make a big difference. So what you really don't want is dancers coming in and congregating and hanging out, you know, before class, because then there's more people in the building and things like that. So you want them to come in at the last minute, take class, and then leave right away, so that you have fewer people, you know, exhaling, air in the building. And I would also recommend, you know, minimizing talking, because we are going to have more particles coming out of our mouth when we're talking, especially if we're talking loudly. And if we're talking loudly, then we're having to keep talking over each other. So voices get louder and louder and louder, and they have more particles, up to 50 times more particles come out of your mouth when you're talking loudly as compared to when you're not talking loudly. So that can make a big difference as well. And I know we're talking dance, not singing, but sometimes people might be singing while they're dancing. I would recommend absolutely not doing that right now, because that can really make the exposure a lot worse.
Thank you. I have, oh, by the way, we are rounding out the hour. Is everyone good to continue for just a little bit? Okay, good. Thank you so much. And then everyone, please know, like, we're trying to get through as many questions as possible. Also, all of these doctors, all these medical professionals are available. You can reach out to them, Doctors for Dancers. You can set up consults. We know there's probably thousands of questions out there, so really doing our best, and they're also available outside of here. We got this question before, and I don't think there was an answer. Any updates or knowledge on the molecule? I know you spoke about other air purifying systems. Anything about that specifically, the molecule, or?
So the molecule, I think in terms of that or any other filtration type system is going to be, again, you know, dependent on the clean air delivery rate. And also these environmental controls are effective to the degree that that's a place where transmission is more likely to occur. So if that person then goes and, you know, is in say they go to a restaurant or something like that where they're indoors and then they get exposed, that those environmental controls are less effective. But the molecule per se, I haven't seen any studies about that. I don't know if anyone else has.
It's not personally where I would invest my money right now with all this going on.
Thank you. All right. Okay, cool. So I'm going to go over to Terry. There's a lot of different iterations around basically Zoom fatigue. Kids, some are going to regular school online, and then there's dance on top of it that might be online. Many people have been Zooming for months. And also any of the doctors, if you want to jump in on this with like all the screen time on the eyes. So I guess the first question would be for Terry, any recommendations around Zoom fatigue? And then if any of the doctors have follow-up on the implications health-wise outside of that.
It's something to get used to, really. Can you hear me all right this time? Thank you. The question around academic work is understandable because you're right in front of the screen, so it's in front of you. But in dance class, it's away, so I can't see the link between the two. Yes, screen time of playing games, academic work, etc. And I'll leave that to the doctors to talk about, but I can't see that there is a link between what you're doing in a dance class with looking at the screen, which is a way away, and when you're holding onto the kitchen counter, or if you've got a bar, I think that's different. I mean, whether boredom sets in, as in, oh, we've got another class to do with that, and the need to be in person with your friends at school, dancing together and all of that. But I don't think there's a corroboration between the academic use of the screen and the dance use of the screen. But over to the doctors to talk about the academic screen time in front of your face.
Well, I think what's happening is just what I'm hearing, and we had a lot of questions that were basically pointing to like anything that you can do around even the psychological aspect. Like, I know that I've really enjoyed what the online classes can bring. I've taught online classes, I've taken, but sometimes I'm like, oh, I miss people, or I feel like everything I'm doing is on a screen. Like, there's something else there, even if I can push through. Is there any mindset that you recommend, or especially when it comes to kids?
Well, I think I go back to what I was saying about a flexible mindset and a fixed mindset. Those that have a fixed mindset are going to find great difficulty with the new future. I mean, someone typed a question just before we finished last time because I said about the new normal, the new norm. There is going to be a new norm, and it's not necessarily going to go back to the way it was. So it's something to get used to. If you have a flexible mindset, you'll use that as an opportunity. So a fixed mindset will start panicking, will start saying it always happens to me, and bring on the negativity, and that will create an illness within themselves. The mind and body link is incredible. It's an intrinsic link. If you start thinking negatively, it's a toxic reaction in your physical body. I don't know whether the doctors will back me up on that, but that's the way that I think. So having a flexible mindset about the situation that they're in, and looking at it as an opportunity. And I mentioned last time about the opportunities of actually doing different styles of dancing online, because no one else is going to see you. You can make mistakes. No one else is going to see you. Why not try something different? There are the opportunities there, and that's what I was talking about, flexible mindset.
That's awesome. I actually did that. I finally got back into West African and Horton, and I was in LA getting to take at Ailey in New York, and it was dope. It was like a lack of pressure there. So thank you.
Can I piggyback on something Terry said? And also, the last time I took a Horton class, it was very unhappy for my body. I was like, oh, this looks awful. I miss it. So Terry mentioned, the fixed versus flexible mindset, and that can help with stress hormones too, right? We know that really high cortisol levels, or the stress hormone that we have, can actually increase the likelihood of you getting sick. That's why we've seen with like very, very elite athletes, sometimes if they overtrain, they're actually at a higher risk of getting sick because they're putting so much stress hormone into their body. And so having a little bit more of a flexible mindset might help you kind of deal with some of these issues a little bit better, and maybe deal with that stress hormone a little bit better, so that you're not actually having this increase of cortisol in your system that does make your immune system a little weaker and therefore potentially more likely to get sick.
Thank you.
Can I add one thing as well with the Zoom classes? One thing too to keep in mind is that because all of this, I mean, it's real time, but it's different. And just the energy spent to be processing people's reactions and the way you're communicating on Zoom, and even in mass, not having the full facial, processing that you usually do to be able to communicate with all those nonverbal cues that people do, it's exhausting. And so I know since we've been doing like video visits with patients, I am so tired at the end of the day from video visits. I'm like, I don't understand why. And I think that's a piece, is that some of it is just a mental exhaustion just because of the way that we're getting this information and being able to interact with people, because we're having to work in ways from a communication standpoint that we haven't done before. And so teachers with your kids, your little bitties that you have going, I'm sure you've seen that you have very poor interaction with your under 6 subset. And a lot of that is because they're just still learning to communicate anyway, not to mention all of this, you know, how to process some of the other nuances of communication when we've lost so much of that in-person interaction. And same thing with masking. You'll find with your classes, sometimes these kids have a harder time because of those nonverbal cues not being there. And so I think moral of that story is everybody give yourself a break. You know, this is exhausting for everyone. It's not something that, you know, you fully do get used to as the same as in person. It's something that's different. And it's that adaptability, like Terry said, that's key. And understanding that there are going to be some pieces that maybe aren't perfect, but it is what it is for now. And so again, looking forward to getting back to the thing we love, which is in person, but just kind of tolerating and managing the thing we have at the moment.
Thank you.
Agreed.
That's a really, really, really good tip. Great, I opened something and lost something else. I wanted to know, Doctor, I'm gonna put you, Dr. Iafrate, I know that there's questions about the pulse oximeter. Did I say it correctly?
Yep, I think Dr. Bluestein wanted to talk about that, if I'm not mistaken, correct?
Is that correct?
Yes.
So I remember hearing at the beginning of COVID that it could help with the prediction, or you could see your blood oxygen levels, and it might show you if you might have it or are getting to dangerously low levels. What's the latest on it?
So for those that don't know what a pulse oximeter is, thank you for giving me a minute to turn it on. So this is a pulse oximeter. These home units were not available up until very recently. They're very inexpensive. There's lots and lots of options available on Amazon, et.cetera. And the top number, it's usually the top number, is the oxygen concentration in your blood, and the bottom number is your heart rate. And so a couple important things to know about pulse oximeters. I highly recommend purchasing one. I think it's a very good idea to have one available. What you're talking about is what's called silent hypoxia. So the chances of somebody being sick and having COVID and being sick enough that their oxygen levels have dropped, usually they will have symptoms related to that. They're not going to have low oxygen and just otherwise feel okay. However, there are case reports of that happening. My anesthesiology colleagues, I've seen plenty of examples of this that they've shared online, de-identified of course, but patients coming in with low oxygen levels. So it's helpful to have for that. It's in terms of, I know there's been talk also about checking dancers between classes or using them to monitor how well you're tolerating the mask during exercise. They don't measure carbon dioxide. So you won't be able to tell if your carbon dioxide level has gone up a little bit because you're rebreathing your own air. And then the other thing is you need to know your baseline level. So if your baseline is 100% and you're at 97%, that's actually a pretty significant decrease, because the way the oxyhemoglobin dissociation curve is what it's called works is it takes a while for your oxygen levels dropping what's called the partial pressure of oxygen before the number on this thing changes. So it's not super sensitive for that. Dr. Meier earlier was talking about sensitivity of tests. In terms of sensitivity for the pulse oximeter, it's not super sensitive for dropping oxygen levels with wearing the mask during exercise. So the biggest thing I would say about that is listen to your body. If you're feeling uncomfortable, maybe take a break. Do the kind of gradually working up to it. And I think it was Dr. Meier who mentioned, maybe you have a fan or something, or being near a window when you're exercising with the mask on, that can be helpful. But those are some of the pros and cons of the pulse oximeter.
Thank you. So well broken down. And then Dr. Meier, there's a lot of kind of protocol questions that have come in about if somebody tests positive. So what are the steps that you recommend that the studio should follow when a dancer tests positive? And just even if if they have a questionnaire and a dancer kind of like has some questionable answers on the questionnaire, what do you recommend? How do you handle not participating? Sorry, yeah.
I love the quote, an ounce of prevention is worth a pound of cure, because I think that if we have a really good safety policy in place in all of the studios, you don't have to worry as much when there is a positive in your studio. And so just like was mentioned earlier, there are several cases out there of somebody who is infected and they were wearing all the proper things and they did not end up infecting all the people working around them. And so if we're doing all of the preventative work with the spacing and the masking, and you're kind of keeping your classes to where there's not a whole lot of interaction with others and in the common areas and all of those things, if you have a positive, it's very easy for you to know who would likely have been exposed. And so I think that one big important thing for you guys to remember as studio owners and instructors especially, you are not bound by HIPAA at all. That is something that is a provider-patient relationship. And so you don't have to protect anybody's personal information in any way. And so I think it's a good courtesy. And if you're not comfortable sharing names, that's fine. But I think it's a good courtesy for you to tell the studio, basically out to everybody, if there has been an exposure, and so people can plan accordingly on what they want to do. And then I think a good policy would be specifically for the people who were in direct contact to contact them directly and just make sure that they are aware of the exposure. I think, again, this is an elective thing that we're talking about, not a have-to thing. I think it would be reasonable for those exposed to maybe that class shuts down for a little while, but that's going to be one that we don't have any hard, fast recommendations on. But it's a tough call overall. But as long as you're doing the planning ahead of time, the likelihood of having it go rampant is low. And so the places that we've seen by and large from the earlier study from South Korea is most of the exposures were unmasked close quarters indoors. Now that we've had 6 months from when that study was really looked at from the earlier part of this year, nearly 6 months, we see that it's true. It's about prolonged exposures with people who are not masked in close contact. So keep that in mind with all the recommendations. You're not going to have to shut your whole studio down if you start doing this stuff early. That said, if you're going unmasked and you're not requiring it in your studios and you're having people go from this acro class into this ballet class and everybody's interacting, the likelihood of you shutting your whole studio down or needing to shut your whole studio down from an exposure or a positive in your studio becomes higher. And that's going to be more time loss, more money loss.
Can I add on to that too? Just as Dr. Meier said, you can tell people that they've had an exposure. You don't have to say who the person was. So you don't have to worry so much about parents getting angry. You just simply, as long as you know as a studio owner or the instructor, you know who it was, so that you can call all those families that have a child that was in that class or have somebody that was in that class. Then you just say somebody was in the class who is sick, and that's it. And you should go get tested, or you should be quarantining. And if you're having any symptoms, you should be sure to, self-quarantine, take temperatures, talk to a doctor, et cetera, et cetera.
Thank you. And then I saw a question about dancing barefoot, and I know I was going to ask one of you about wearing dance socks. Any recommendations about what to wear on your feet, and is it okay to dance barefoot?
That's one that, for me, I'm not sure that I think the risk of adding something new to the foot, like socks, I don't know that that risk is going to be enough reward for me. Because if we're thinking about what this is this is spread from respiratory droplets into the respiratory tract, or it's not really something that we're going to be secreting from sweat. It's not something that we will just absorb or secrete through our skin. And so long as we're not doing a ton of floor work, or we're not touching our face with our feet, or that said, our face, hands touching our feet, I think we should be fine. And so I would encourage, not to do the floor work piece if we can avoid that for now. But I think dancing barefoot probably is fine. If I'm touching my shoes, that's going to have a similar risk as to if I'm touching my feet. I just don't know that we would get enough gain to take the risk of maybe slipping on regular socks because that's what someone has and they don't want to buy something that maybe has more, or getting stuck trying to turn and maybe hurting something because biomechanics were different. I think it's a lower risk thing to dance barefoot overall.
Thank you. And
Yeah, we have.
Sorry.
I was just going to say, we have to remember that dance still has injuries associated with it, right? So you can still get hurt when you're dancing. Just because you're wearing a mask and it's COVID doesn't mean it goes away. In fact, because a lot of people haven't been dancing as much, they're probably a little bit deconditioned. Both their VO2 masks, or their oxygen consumption, and then also the muscle tendon condition. So you might be at an increased risk of injuries when you first go back to dancing. So doing things that we can do to try to decrease the risk of other injuries that you get is also in your best interest.
Thank you.
Yeah.
And also, doctors, I'm going to wrap up in a couple of minutes, and I want you to think if there's any question that something you're really passionate about bringing up that I haven't asked you yet. In a moment, I'll ask you to raise a hand, but I want to give you a moment, except for Dr. Bluestein. Sorry, I'm going to put you on the spot. There was a question around water coolers. Is it safe to refill water coolers? And then I got a question about, what about when dancers need to get water or a quick snack? Like, they'll have to take off their masks. What's the best way to do that?
So the snacks should definitely be things that are, self-contained, easy to eat, that are not messy and things like that. And there should be a way that they can ideally go outside maybe to have their snack or to drink their water, especially right now, at least in the US, a lot of places you'd be able to go outside so that when you take your mask off, you're not exposed, you're not as much at risk of exposing other people. In terms of the water cooler, it's best to leave the water coolers off. People should be bringing in their own water and bringing in enough to last them for, as much as they need, during the day.
Wonderful. Thank you. And then while you think if there's I still have a few more questions I can ask, and we'll end in about 10 minutes, like hard cut off, but is there anything, my medical professional team, that I have not asked you that you're like, we got to talk about?
I have a couple of things that I feel like just need to be reiterated that we didn't necessarily touch on this time, but we did talk about last time.
Yes.
Washing hands is still very, very important. It is one of the best ways to decrease the risk. Even though we know that respiratory droplets seem to be the thing that is most likely to cause spreading, your hands go near your mouth a lot. Your hands touch other things that touch other people. And so washing your hands, and if you can't wash your hands, using hand sanitizer that's at least 60% alcohol is important. So do not forget that. Talking a lot about all this, but this matters too. The other thing is, we know right now that kids don't necessarily get as sick as adults from this necessarily, but we don't know how much of an infection they have and what their transmission rate is yet. And so there's a study that's being done by the National Institute of Allergy and Infectious Disease. So Dr. Fauci is kind of like helping run this study, and it's pending. We don't have the results yet, but it's following 6,000 kids from 2,000 families to see rates of infection and transmission. So even though you say, oh, my kid's pretty healthy, they'll probably be fine, it's not just about your child. It's not just about the kids in there. It's about what those kids could potentially spread to everyone else around them. And so we want you to go back to dance. None of us are saying do not dance. None of us are saying don't do the thing that makes you happy. We're saying do it smart, do it safely, so that we can keep these numbers down. Because as of right now, I hate to be morbid, but over 166,000 people, I think, have died in the United States from COVID so far. And at the rate we're going right now, it's probably going to go up to about 190,000 by the end of the month. That's a terrible number. So we want to all do our part to decrease that risk. And the other thing I just want to point out is that there's a lot of false information out there in social media world. And so I just want to congratulate everyone just for taking the right steps to say, let me educate myself properly about this and do this the right way. We know that we don't have all the answers yet that we have available right now. And so that's the most important thing. So congratulations, Kudos.
And I actually had a question. This was like in my head, did not know that you're also psychic, Dr. Iafrate. I was going to ask, what are your recommendations? And everyone, I'll do a screen share at the end, but I put in the file for the All About Masks webinar that's going to be happening on the 27th. My medical professionals, what are your recommendations when like somebody sends me, information on COVID and the transmission and like the percentage of blank, and I never know where to go, maybe the CDC, but where do you fact check or what do you recommend to everyone? Because there's so much info going around in social media.
Oh, I guess I'm not muted. I was going to unmute myself, but I wasn't muted. So one thing that I think is a good rule is if you had to seek out the information, it's probably more valid than if the information came to you. So, the media is pushing out all of this information. And I think that, instead of looking at everything that's being pushed out to you, you seek out information. So look for, again, the CDC, the WHO, Johns Hopkins has a fantastic website. I know there's, a bunch of different, organizations that have medical organizations that have really, really great information. I believe that we also are sharing a link to an organization in the UK that had a page specifically about specifically about performing arts medicine and COVID. And they had a lot of great things in there that were specific to performing arts. And so I think that, that also will help with anxiety, because the whole media, but if they're referencing a particular thing, go find that thing and read that, because oftentimes they misinterpret on purpose, and they'll write the headline because they know a lot of people will only see the headline.
Yeah, media likes to sensationalize, right? Everything needs to be like next level big because it's how we get people to watch it. So if you have something that you get sent that you're like, I'm not really sure if this is real, I agree. CDC, Mayo Clinic also has a really good website, along with Johns Hopkins, or even at least send us a message, send Doctors for Dancers a message and just say, hey, I heard this, does this make sense? Because if we don't know the answer, we'll at least try to point you in the right direction.
I sent in a list to Doctors for Dancers of links. So One Dance UK, International Association of Dance Medicine Science, Performing Arts Medicine Association, the British Association for Performing Arts Medicine, and any permutation with those words. But I sent the links in to Doctors for Dancers, so that they should be not necessarily on the screen now, but in the information if you request it. And that is all about returning for dancers returning to studios or dance companies starting up. There's a whole list of do's and don'ts.
Thank you. And Dr. Meier, you're about to say something?
Yeah, I was going to say, as far as being able to tell what's good information and not, another thing that I think is relatively reliable is check for sources and then check those sources. So if you have something forwarded to you or a Facebook post or something that comes to you that's kind of been going viral and going around, if it doesn't have any sources or links to the information, it's probably false. It's not always, but probably. Usually the reputable scientific things will have the sources linked. So when you see those little numbers or scroll to the bottom, if it's got sources, not only check for those, but then click on them to make sure that's what it says. Because I got one from my grandpa yesterday telling me all the ins and outs about COVID from Johns Hopkins. Well, it wasn't right. It wasn't just medically sound information, and it's just basically a Word document. It didn't have any sources. It didn't have anything on it. It was just something that somebody put together and has been spreading around. So just check for those sources. That's another good rule of thumb.
Thank you. We're going to wrap it up now. I want to thank everyone, first of all, for attending. And If you'd like to send Doctors for Dancers a quick email that if you're a studio owner or manager that your studio attended, we'd love to give you a shout out. Thank you to the medical professionals for taking your time and letting us pick your brains, and everyone really for showing up and caring. Here's the thing, there are so many questions, there's information constantly changing, and I think the best thing hopefully is that we're empowered through this communication and through learning. Like, I'm learning about how to learn right now and not take everything at face value in research. So thank you, everyone. Thank you, doctors and Doctors for Dancers. So